Good morning, everyone. Good morning, good morning. Welcome. We'd like everyone to start to move to the seats now. We're going to get started in just a few minutes. So if you wouldn't mind just coming down and taking a seat, and we'll be prepared to start. Take a seat wherever you like. Okay, and then one of the speakers is right there. Okay. All right, there's still a few more seats available. Okay, that's absolutely fine. Yeah. Hi, I'm Nicole.
How are you? Well, we are so glad to have you. Yes. Everything you're doing. I'm so really wrong. I'm the district supervisor for District 9 Mission.
All right. All right. Thank you for coming on up and taking a seat. One more minute, just one more minute. All right. Thank you, everyone. Okay. So good. I like the enthusiasm. Good morning, everyone. Thank you all for being here today. My name is Nicole Barnett. I'm the Chief Operating Officer here at Planned Parenthood Northern California. And I provide regrets for our CEO, Gilda Gonzalez, who couldn't be here today. But we're especially honored to welcome all of you here to what we call our flagship. This is our flagship facility. This is the busiest of our 17 health centers that serve patients all across Northern California.
I'll let you do the intro, but
Okay.
if you don't mind starting when she gets here.
Oh, no problem. So, good morning again. So a little bit about Planned Parenthood Northern California. Again, we have 17 health centers. This one, our flagship, replaced the health center that was on Valencia Avenue. And many of you who had had a chance to visit that health center knew it was very small. The first time I walked in and visited it as a board member 8 years ago, I was surprised at how many patients they could serve there in such a small space and the dedication of the team there as well. It literally was like one hallway with 2 exam rooms on either side. So we knew there was an unmet demand, and we knew that we could do better, and we wanted to do better. So as a member of the board of directors, along with the executive team, we went on a journey to figure out how to do that, to find space here in the city that was central to public transportation, easy to access for our patients, but most importantly, to increase the footprint for services. So the health center above us is literally triple, maybe more than triple the size of what we had on Valencia Street. So it's really exciting that we have that for our patients, this beautiful space, but also that we have this beautiful event space to share with all of you. So we're really, really happy to have you all here today. Another unique thing about our Northern California affiliate is that we serve communities and counties all the way as far north in Northern California as Humboldt County, Eureka County, Butte County, Mendocino County. These are areas that if you've been there, they are really truly becoming healthcare deserts. And we are proud to be able to provide reproductive healthcare services in areas where there's not a lot more available for people in terms of healthcare. And we are committed to be there and committed to serve. So we span quite a large geography in Northern California when it comes to reproductive health services. So again, happy to have you all here. And with that, I'll wait for a cue. Yes. No problem. No problem. So while we wait, any questions for me about Planned Parenthood Northern California that I could quickly answer? Wow. Christian, you probably have the most accurate numbers at this time of the number of patients we currently serve. Yes. Yeah, if you look at it in terms of encounters, because that's another way we look at how many times people come in for any episode of care, whether it's birth control, whether it's abortion services, whether it's gender affirming care, whether it's STI treatment, cancer screening, about 160 to 170,000 encounters a year. We've seen quite an uptick, as you can imagine, in the last couple of years. Yes, welcome. Welcome. So good morning again, everyone. Thank you all for being here today. Again, I'm Nicole Barnett, and I'm the Chief Operating Officer here at Planned Parenthood Northern California. And again, regrets from our CEO, Gilda Gonzalez, who couldn't be with us, but she is so honored to share this amazing space with you all today. As we know, 2 years ago, the U.S. Supreme Court overturned Roe v. Wade, and this has absolutely reshaped the landscape of abortion and reproductive healthcare rights and access in America. Today, I can't believe it, but there are 21 states that have banned or who have severely restricted abortion services altogether. Sadly, we see attacks on reproductive freedom across the country going on even beyond abortion services. We're witnessing assaults on access to contraception, in vitro fertilization, and gender-affirming care. These efforts aim to undermine the autonomy of women in particular. But in reality, all patients are gravely impacted by any deterioration in access to reproductive health services. The message from anti-reproductive freedom zealots is clear. They won't stop until abortion and Planned Parenthood services are completely abolished. In this ever-evolving environment, we need all levels of government to act on the affirmative when it comes to reproductive freedom. That's at the local, the state, and the federal level. Work on the local level is especially vital in supporting the well-being of health center operations by improving our security measures and implementing buffer zone ordinances that protect our patients from aggressive protesters just outside our health centers. Local coalitions like the Bay Area Abortion Rights Coalition are critical to finding solutions to problems and working collaboratively to strengthen all of our efforts. The San Francisco Reproductive Freedom Act, which you will hear more about in a moment, is another shining example of San Francisco leading the way once again at the local level. I want to thank everyone for their commitment and dedication to this cause. And now it is my great honor to introduce someone who has been a longtime supporter of Planned Parenthood Northern California and a vocal reproductive freedom champion. Please join me in welcoming Mayor of San Francisco, London Breed.
Thank you so much, Nicole, for the introduction and for opening up the space as an opportunity for us to come together to deal with something that we all never thought we'd be dealing with. And in fact, when Roe v. Wade was overturned 2 years ago, that set in motion a momentum that I think has brought so many women all over this country together to fight for the ability to make decisions about our bodies. We shouldn't have to explain what it is that we need to do when it comes to any health decision. It should be protected. And the fact that we have to now fight against policies that provide some technical details around what you can and can't do, it's really offensive. It's our body, it's our choice, and we should be able to make any decision we need to. And we shouldn't even have to talk about whether or not, in the case of rape or incest or this or that, those shouldn't even be a part of the equation. I am really proud that here in San Francisco, when Roe v. Wade was overturned 2 years ago, um, our director of the Department of the Commission on the Status of Women, Kimberly Ellis, through her visionary leadership, created the Bay Area Abortion Rights Coalition as a way, bark like, like we bark back, created this as an opportunity to bring the various Bay Area counties together to prepare, sadly, for women who might be traveling to the Bay Area and looking for reproductive care. No questions asked. And I appreciate her leadership and what we've been able to do to provide resources necessary to ensure that it's possible and that we are able to be that sanctuary for women. It is really extraordinary to be here today and to see this coalition of leaders here joining us to make it clear, including members of the Board of Supervisors, who you'll hear from in just a moment, but I'm really proud of the work that they have done and will continue to do to stand up for reproductive rights in whatever capacity they serve. Why is this important? Well, it's important for some of the reasons that Nicole stated, but more importantly, this can't just be a conversation that we have at the Board of Supervisors. This can't just be an ordinance or something that we pass. We have to demonstrate with the voters of San Francisco what our values are and how we will continue as a city to fight against any injustice, that reproductive health and freedom will continue to be protected in the city in whatever way is possible. And one of the things I wanted to touch upon, because we have two of those crisis pregnancy centers in our city that have been very misleading to women. And it's very unfortunate when you are going to understand what all your options are. You're being told that, like, you will go to hell if you get an abortion. And we don't need people, telling someone at a very vulnerable moment. We don't know what they're going through and what it could lead to. But the fact that, these kinds of centers can exist and people are not aware of what they are when they're walking into the doors is another reason why we need to ensure that signage is appropriate. We need to ensure that we are using every resource that San Francisco has to protect reproductive freedom in any shape or form. And so that's what this ballot measure represents. So the Reproductive Freedom Act will do a couple of things. It will declare an official policy of the city to safeguard comprehensive reproductive freedom. It will require our Department of Public Health, our Dr. Grant Colfax, the director, is located here today, to provide public information about where people can access reproductive services, including some of our city-supported clinics all over San Francisco. It will prohibit the use of city funds to cooperate with or provide information to support prosecution of an abortion or reproductive health services that is lawful in California. So we will not be moved into something that we don't believe in. It will restrict city funding to reproductive health facilities that do not provide or refer for comprehensive reproductive health services. They have to have all those services. It will require signage at crisis pregnancy centers that tells people those locations do not provide comprehensive reproductive health care, and where they can get information about locations that do. It will establish a fund that private dollars and city dollars could do to support people in accessing reproductive health care. And it will amend the planning code to clarify that reproductive health clinics are a permitted use wherever non-residential uses are permitted. So a lot of technical city bureaucracy, but ultimately it accomplishes the goal that's most important to us and why so many of us are here standing today. I know we have a number of speakers, and I will save my long list of thank yous to the end because I want to make sure we have an opportunity to hear from all of them. But I am so grateful. I'm excited. I'm humbled that so many of us have come together in this fight to ensure reproductive freedom for all women. And I am proud that this is not just a San Francisco thing, but this is a Bay Area thing. This is all of our 9 Bay Area counties coming together to demonstrate that we, whether it's our district attorneys in other places or elected leaders in other places and public health folks in other places, we are all together for one purpose, and that is to protect reproductive freedom for all women everywhere. And with that, I'd like to take this opportunity to introduce another supporter of this initiative, the Board of Supervisors member, soon to be Assembly member, Catherine Stephanie.
Good morning, everyone, and thank you all for being here, and thank you to our fabulous mayor for initiating this. I am just so grateful for Planned Parenthood. I am the supervisor for District 2, and Planned Parenthood is in District 2, and I have been privileged to work alongside you to make sure that we have security access and to make sure we have the funds to provide for security so people can safely access the reproductive health care here. And of course, to then work with our city attorneys to improve the buffer zone and things like that. So it's really a privilege to be able to work with Planned Parenthood. And I want to start out today by expressing my gratitude because I think it's so important to really stop and reflect on what we are all grateful for. And I am so grateful to live in a city like San Francisco and the Bay Area that cares so much about the reproductive freedom for all. And I want to thank the mayor again and my colleagues for leading that charge, and all of you up here. It just means so much to me when I know that there's a problem, that I am grateful for the people that I get to work with to get to that problem. And I want to thank you too. I'm so grateful for Planned Parenthood for everything you do. But I am in a lot of fear. And I think we all talk about it. We talk about the fear of what's happening in our country right now, what's happened since the Dobbs decision. Since the Dobbs decision. And I have a 14-year-old daughter. And the fact that my daughter has less rights than I did growing up absolutely terrifies me. The fact that they're prosecuting a woman for murder in Texas right now because she decided to end her pregnancy in 2022 is absolutely terrifying to me. The fact that 21 states since Dobbs have enacted more restrictive laws since Roe v. Wade was overturned is absolutely terrifying to me. And you know that 22 million women and girls of reproductive age are affected by this. So the fact that we are a beacon of hope here in San Francisco means so much to me. And that fear that we all are in, especially women, I know, and especially us that have daughters, you can't sit in that fear. And so it's so important for me when I'm in this much fear, I say to myself, please remove this fear and direct my attention to what you would have me do. And what we are doing today, we are getting into action. And the fact that we are in action in a way that is so powerful to let the world know, to let the entirety of our country know that San Francisco will not stand for this means so much to me, because my fear then is alleviated when I know we are in action. So again, I want to thank everyone that I am here with today to really take this issue by storm and say, we are not going to take it. We are not going to let you have control over our bodies, our daughters' bodies, and we are going to make sure that we do everything in our power here in San Francisco to turn the tide. So thank you, everyone, for coming today. And I want to take this moment to introduce one of my colleagues who I just adore, Supervisor Melgar, who I know cares about this issue, and she is also a mother to daughters as well.
Thank you, everyone, all these wonderful women and allies. My name is Mirna Melgar. I'm the supervisor for District 7. I am also the only Latina on the Board of Supervisors, the first one to be elected without an appointment from a mayor first. And I say this because we are underrepresented in politics, but we are overrepresented in terms of the space of poverty in California. In California, the face of poverty is a single mom, and she's usually Latina. And I say this because in San Francisco, we have always been this place, this beacon, where people come from all over the world, all over the country to reinvent themselves and to be their best selves, upward mobility, a place of refuge. My family came here when I was 12 from El Salvador, a place where abortion is still illegal, where people have gone to jail and been prosecuted for having miscarriages. This place, San Francisco, embodies those values of openness, of tolerance, of freedom, and we must continue to do so. I am a mother of 3 girls. I think that what I am seeing right now, in terms of the changing messaging around our country about the basic human rights of controlling your body, is deeply terrifying, as my colleague said from District 2, soon to be Assemblywoman, Stephanie. But also, we are still recovering from this pandemic as a country, as a city, and as a country. There is no such thing as economic progress, as upward mobility, as freedom for everyone without reproductive rights, without the most basic right to have control over your body, your family, who you are responsible for. There is no such thing. So if we are going to be consistent with our San Francisco values, we must continue to be that beacon of hope, that sanctuary for everyone in our country to be able to access basic human rights, basic healthcare. I'm so grateful to Planned Parenthood and to the mayor, my colleagues, everyone in the Sitta family. Most grateful for Kimberly Ellis for having been so clear from the beginning that we must do this. The practical things in this legislation. So I was on the Planning Commission when this was entitled. People picketed us, actually. One of my colleagues had graffiti scrabbled all in front of his house. It was pretty intense. So having there be just no question that this is a permitted use, no matter what, is like really, really important in that process. And so for both the practical reasons, but also the values that we are putting out into the world and doubling down our bark, because we are all activists here and we are going to continue to be that beacon of hope for the rest of the country as long as we need to. So thank you for being here. And I will now introduce my dear, dear colleague that represents the former home of Planned Parenthood in District 9, Supervisor Hillary Ronan.
Thank you, everyone. It's very exciting to be here today. It's an honor to be here. And that is because I think what all of us have felt since the Dobbs decision, since the unthinkable reality of Roe v. Wade being overturned in the United States of America, is how do I fight back? What do I do in order to make sure that my daughter, my mother, my sister, my cousins, my aunts, that they will continue to have the only say over their own bodies, because that's the way that it should be. And as the supervisor of the former location of Planned Parenthood, I have worked on these issues for decades now. And I thought that San Francisco, especially with Kimberly Ellis in charge of the Office on the Status of Women, I thought we had done everything we could possibly do with our local laws to protect women's right for control over our own bodies. And the mayor found a ton of additional things that we can do. And that makes me feel fantastic to be part of, because and Supervisor Stephanie touched on this. It's that inability to figure out what we can all do to fight back. And so by putting this on the ballot, we could pass this at the Board of Supervisors, but by putting it on the ballot, we are telling every San Franciscan, you can do something meaningful in your own city to fight back. You can be part of making history and laying down the law and saying this is who and what we stand for. And we're not going to do this to you, for you as your elected officials. We're going to bring you into this process and we're going to all join and fight together. And that's precisely what we should be doing now. And I want to thank you, Madam Mayor, for leading on this and giving us the opportunity to fight back. It means a lot. So thank you. I am very honored to now introduce our district attorney, Brooke Jenkins.
Thank you, everyone. I am Brooke Jenkins, the San Francisco District Attorney, and I am honored to stand alongside Mayor Breed, the women of the Board of Supervisors, of course, our head of the Department on the Status of Women, Kimberly Ellis, as well as a number of other San Francisco leaders today to really call on the voters to pass the San Francisco Reproductive Freedom Act. You know, when I think of the Dobbs decision, I don't think any of us saw the domino effect that it would have on so many other rights that we have. I think we all understood the impact that it had on the right to an abortion. But as I have watched things play out and as I have watched other opportunities for reproductive health care be diminished across this country, I had to confront a personal story of mine, which is that not that long ago, I was told by a physician that I would not be able to naturally conceive children. And so it was incumbent upon me to seek reproductive health care to figure out how I was going to be able to have children. And that meant considering in vitro. I actually went through in vitro, although I did learn after that I was capable of having kids naturally after paying a large bill. But why I bring that up is because as I've, again, watched this play out, we have seen across this country families, both LGBTQ families as well as male-female marriage partners be denied the access to in vitro fertilization services because of this decision in a manner that I don't think any of us could have anticipated, like I said. And so for me, this is very personal. I am here to stand alongside everyone for all of these rights to be protected here in San Francisco. And this act doubles down on the city's commitment to advancing reproductive rights for all women. San Francisco has been and will always be a leader in this area. And so I thank the leaders that stand behind me for continuing to push us forward. I think just like Supervisor Ronan said, you know, right in a moment where you think there's nothing more that you can do, they have figured out something else that could be done to continue to make sure that women in San Francisco and from all over this country can come here and have access to the care that they need. And so working to ensure that patient privacy is respected and no information is shared with jurisdictions outside of California that don't share our values and would seek to demonize women and or prosecute them for seeking such care is just something we cannot accept and that we must protect against here in San Francisco. My office will continue to do everything we can to ensure that women who come here to access such care and the medical professionals who provide that care are safe and protected. And let me be crystal clear that we will not tolerate any threats of violence or violent acts that occur against women or against facilities like the one we stand in today. If you come here to harm people or to do things that threaten them and that make them feel that they cannot access such services, we are not scared to prosecute you. And so I want that to be clear, that we are coming today together to push for this act to be passed. But I stand here also as the district attorney saying we will do everything we can to protect those that seek this care. And so at this time, I'm honored to pass it off to the CEO of Essential Access Health, Amy Moy.
Good morning, everyone. I'm Amy Moy, co-CEO of Essential Access Health, and we are a Bay Area-based organization that advances reproductive equity and champions and promotes quality sexual and reproductive health care for all. And it is the honor and privilege of my career. I've been doing this for more than 25 years, and 25 years ago, we started ringing the alarm bells that the Supreme Court can overturn Roe v. Wade, and people wouldn't believe it. And now the devastating nightmare that we foreshadowed has come to bear, and the impact has been rapid and has impacted the lives of more than 22 million people across the country. When I can wake up in fear, I think about the helpers. And that gives me solace that I wake up and know that here in California and in San Francisco, we have leaders that understand that access to abortion is essential healthcare and that the ability to have bodily autonomy is critical for our individual, our family, and community health and well being. And so at Essential Access, we are proud that we have established and in partnership with coalition partners and state leaders implemented new grant programs to support abortion access statewide. And we are proud to also provide funding to Planned Parenthood, Access RJ, and other key partners to make sure that anyone in need of abortion care, whether they live in San Francisco, in California, or other states, can come to California as a safe haven. But the funding, while unprecedented, is not enough to meet the need. So we have to make sure that we continue to look at how we can continue to bolster resources to expand access points. So as states across the country continue to enact really cruel and callous measures that restrict access to essential health care and bodily autonomy in California and San Francisco, we have an opportunity and the obligation and responsibility to use every tool possible to protect and expand access to essential health services. This new measure introduced builds on San Francisco's long history of taking bold action in support of equity and justice, and also provides a really unique model for other jurisdictions to adopt and adapt, building on San Francisco's leadership as a leader. And we urge San Franciscans to stand up for San Francisco values and support this measure. And we also thank Mayor Breed, Madam Mayor, for her leadership bringing this forward. Thank you. And it's my pleasure to introduce a colleague and champion, Jessica Pigney-Gill, Executive Director of Access Reproductive Justice.
Good morning, afternoon, everyone. My name is Jessica Pigney-Gill, and I'm the Executive Director at Access Reproductive Justice, which is California's statewide standalone abortion fund. In the year following the Dobbs decision, Access Reproductive Justice supported about 1,800 people across California and beyond in accessing abortion care. So the primary folks that we support through our abortion fund are folks in California accessing care here in the state, folks who come from other states to California to access care. Not only following the Dobbs decision did we see an 150% increase in our caller volume, but we saw about a 10 to 15% increase in support needed for our out-of-state patients. And we know that the level of care that folks who are coming from out of state need is drastically different and increased. We're looking at airfares, lodging, transportation, childcare, food, a number of kind of wraparound services that make it possible for people to access the reproductive health care that they want and need. And so Access RJ is really pleased to be here today to support the Reproductive Freedom Act, and is grateful to Mayor Breed and the City and County of San Francisco for working to further human rights. We know that even in a reproductive freedom state like California, states and municipalities, it is imperative that we affirm our position and ensure that our citizens and those forced to travel here for abortion care know and understand that they are safe, they are seen, and they are heard. As California's statewide abortion fund, Access RJ sees and hears every day the experiences of individuals seeking abortion care throughout the state. We're regularly answering our callers' questions about whether they will be judged for asserting their bodily autonomy, whether they will be treated with dignity and respect that they deserve. This initiative ensures that if approved by the voters in November, San Francisco City and County will unequivocally say yes to each of those questions. Access RJ callers who predominantly identify as Black, Indigenous people of color, low income, and in their 20s will undoubtedly benefit not only from knowing that San Francisco City and County validates them and their choices and experiences, but is also doing everything possible, as others have mentioned today, to ensure that they have increased access to financial resources through the Reproductive Freedom Act, as well as protection from discrimination and misinformation that's quote unquote provided via fake health clinics, also known as crisis pregnancy centers. Finally, the Reproductive Freedom Act would further protect individuals asserting their bodily autonomy and decision-making power from being investigated or prosecuted for such. At Access, we are building towards a future where all people in California have the freedom and resources necessary to make empowered and dignified decisions about their sexual and reproductive health, including the decision to have an abortion, without shame or stigma, and regardless of their race, their religion, documentation, or economic status. And we're hopeful that this initiative will help us get even a little bit closer to that very reality. And with that, I'm very grateful to turn it over to our partner and colleague, Kimberly Ellis from the Department on the Status of Women.
Well, a big thank you to everyone who came out today. Good afternoon, I'm Kimberly Ellis. I am the director for the Department on the Status of Women. I have the privilege of closing us out. Don't worry, this is going to be short, sweet, and to the point. The Reproductive Freedom Act is all about San Francisco leveraging its strengths and assets to codify reproductive freedom and justice into our rule of law. With the high-stakes presidential election this fall, this ballot initiative is an example of San Francisco proactively contingency planning. We are battening down the hatches so as to not get caught flat-footed. Because if there is one thing we have learned from the pandemic and from the fall of Roe v. Wade, it is that this is not a drill. It is go time. And with this measure that our mayor has announced today, San Francisco is once again demonstrating that it is at the ready and prepared to lead. Make no mistake about it. The Reproductive Freedom Act is a call to arms and to action. And what Mayor Breed has done with this initiative is given the voters of San Francisco the opportunity to say, when you come for us, when you come for our rights, not only will we bark, but we will bite back. Thank you. Roof.
Well, first of all, thank you to all our speakers today, but I do want to take this opportunity to acknowledge a number of folks who are joining us here as well. Thank you to the Contra Costa District Attorney, Diane Beckton. Sorry, I'm a little tongue-tied. Thank you so much for coming here and working with us as well. We also have a couple of members who are here from the Community College Board, including Morel Green and Chanel Williams. Thank you both so much. And I'm really proud that so many of our department heads are joining us here, including our, as I mentioned, Dr. Grant Colfax, also our county health officer, Dr. Susan Phillip, is joining us here as well. Director of Public Works, Carla Short, our city administrator, Carmen Chu, head of early child care and education, Ingrid Mosquita, Maria Sue, the director of Department of Children, Youth, and Families. And we also have a number of Democratic County Central Committee members, including the chair of the DCCC, Nancy Tong. Thank you so much for being here. As well as Emma Hyken and Lily Ho. And did I get everybody? I got almost everybody. And also from Partners Ending Domestic Abuse, thank you, Beverly Upton, for joining us here as well. I know Gilda Gonzalez couldn't be with us here today, but we want to appreciate her work and her advocacy all over Northern California through Planned Parenthood, as well as so many of our partners, including our City Attorney, David Chu, our Treasurer, Jose Cisneros, and our State Controller, Malia Cohen. It definitely takes a village of people, and as you can see, there is a force of a village here to not only roll up our sleeves and to bark and to bite, but to get the job done and to demonstrate that San Francisco will continue to lead, will continue to partner and collaborate, and will continue to do everything we can to protect the reproductive freedom of all San Franciscans and people all over this country. Thank you all so much for being here today. Do we want to do